All right, thank you all so much for joining us this morning. We are so glad to have so many with us to announce something we think will help us in the ongoing fight against opioid abuse. We have several council members with us today: Jennifer Massotti, Bill Farmer, Preston Worley, and Amanda Mays Bledsoe. We also have Commissioner of Public Safety Ken Armstrong, along with Police Chief Lawrence Weathers, Fire Chief Kristen Chilton, our Director of Community Corrections Steve Haney, Amy Baker with our Office of Substance Abuse, Stephanie Nelson with Senator Mitch McConnell's office, Leslie Small with Congressman Andy Barr's office, and we'll be hearing in just a moment from our Commissioner of Social Services, Chris Ford, Health Commissioner Dr. Humbaugh, and Sheriff Kathy Witt. Today, I'm pleased to announce that Lexington has received a $2 million grant that will provide funds for additional weapons we can use in the war on opioid abuse. As we all know, too many citizens throughout Lexington have been impacted. This grant, which stretches over 4 years, will largely be used for naloxone kits to be distributed through the health department and to supply deputies at the sheriff's office with a life-saving medication designed to rapidly reverse opioid overdoses. This grant will also allow us to hire an overdose prevention coordinator, someone to help get people who are overdosed into treatment. And something else. The grant will fund outreach efforts to help people understand the state's Good Samaritan law. That law provides legal protections for individuals who call for emergency assistance in the event of a drug overdose. We all know that opioid abuse has become a public health emergency, and we've worked hard to put programs in place that our citizens need, such as the needle exchange program at the health department, intervention and treatment programs at the detention center, workshops at area churches, equipping police and fire with naloxone, and joining a class action lawsuit to hold pharmaceutical companies accountable. This grant will help us build on these programs. We want to thank Senator Mitch McConnell's office and Congressman Andy Barr's office for their support of the city's grant application. Chris Ford is our Commissioner of Social Services. He and his office have worked really hard to secure this important grant. Chris? Yes, sir.
Thank you, Mayor, and good morning. Our Department of Social Services is fortunate to play a small role in the city's strategies to confront and combat substance abuse. I wish to thank Mayor Gray, our administration, and the Urban County Council for its support of our substance abuse intervention program since its establishment in the summer of 2015. I also want to acknowledge our program coordinator, Amy Baker, who led the development of our grant proposal, and our team in the Division of Grants and Special Programs for standing with us as we pursued these much-needed resources. I also want to thank our public safety leadership team here at City Hall. Commissioner Armstrong, Chief Weathers, Chief Chilton, Director Haney, all have been very engaged in this work. We all know it's our first responders who are on the front lines of this community battle with opioids and substance abuse each and every day, and we hope this grant will help their work. Just a few key facts about the grant. In 2017, there were 187 fatal overdoses in Fayette County. This grant is funded by the U.S. Department of Health and Human Services through its Substance Abuse and Mental Health Services Administration. The title of this initiative is the First Responders and Community Partners Overdose Prevention. Its goal is to strengthen Lexington's overdose prevention networks by expanding infrastructure and availability of resources, of which the mayor mentioned earlier. Work is already underway this fall to activate these initiatives. We'll be working closely with the mayor's office, the administration, and again the council to move forward as quickly as possible. We will continually to seek ways to efficiently administer these grant funds and to leverage with additional resources when available. In addition, the UK Center for Drug and Alcohol Research will assist in grant evaluation during the next 4 years. This grant notification and announcement comes at a very opportune time for us at City Hall. Since this spring, our department has been working with a research team at the UK College of Medicine, for an opioids misuse resource and needs assessment. The findings of the need assessment will formally be presented to Mayor Gray and council members at this afternoon's work session at 3 p.m. In closing, I again express excitement and gratitude for the opportunities this grant offers our city. We look forward to further uniting the efforts of social services and public safety, and even more importantly, to inviting residents and community leaders to the table as we move forward in helping residents impacted by substance use disorder to find recovery and regain health. Thank you.
Thank you, Commissioner. And I see Councilmember Susan Lamb has joined us. Susan, thank you for joining us. Dr. Craig Humbaugh, our health commissioner, has seen the tragedy up close on the front lines. He has seen the sorrows that this opioid emergency has brought us. Commissioner, will you share with us now how the health department will benefit from this grant?
Yes, sir. Thank you, Mayor Gray. Yes, sir. Thanks, Mayor Gray, and thank you, Commissioner Ford. We're very pleased to be partnering with Urban County Government on this particular project. When Amy Baker and Commissioner Ford's team called us up and asked us to partner, we said certainly we'd be glad to do that. As you've heard, overdoses in this city continue to be a serious public health problem. Overdoses in Lexington residents doubled between 2013 and 2017 in the city. We at the health department continue to work to train about naloxone and distribute naloxone to the public as part of the needle exchange program, but also in a wider sense as well. As you all probably know, naloxone is a reversal agent for opioid overdoses, so it reverses the serious effects of an overdose and it therefore can save lives and give people another chance, a chance at recovery. But for this strategy to work, we have to have naloxone in the hands of people in the public, at work, at home, at play, and we have to have people who understand how to use the naloxone in a time of crisis at an overdose to be able to save a life. To date, at the health department, we have distributed and trained and distributed over 1,600 kits, partnering with UK College of Pharmacy, UK College of Public Health, and Drug Free Lex. And now this grant award will help to provide additional kits for us to be able to fund those kits so that we can distribute them to some of the highest risk populations in the city. So we very much thank the mayor, Commissioner Ford, and all those who helped to make this grant award possible.
Thanks, Doctor. Thanks, Doctor. And finally, this grant will help supply our sheriff's office with a much-needed supply of naloxone. Sheriff Kathy Witt.
I too personally want to thank our mayor, Mayor Gray, for his vision, his commitment to our citizens, his commitment to his employees, and to the Office of the Fayette County Sheriff. When this grant was first applied for and the city did not receive it, we wondered how we were going to help those who were overdosing in front of our courthouses, and it does happen weekly. And so now today we have to wonder no more. So thank you, Mayor Gray, for that commitment to helping us help our citizens save lives and to help our citizens keep their most cherished possession, their family members, their sons, their daughters, mothers, fathers, brothers, and sisters. Together, this will be a great tool in our war in fighting this horrific epidemic. And so I also just genuinely want to thank the U.S. Department of Health and Services for making this decision and for seeing the need here in Lexington, Fayette County. Thank you.
Thanks so much, Sheriff. Okay, we'll be available for one-on-one interviews. And thank you all so much for coming out today. Thank you so much.